Cheers to the new MicroSkin peels that are available now for you to order, and you can have them in your salon and save one beautiful skin at a time. There are two different strengths. We have the first one at a 35% and the second one at a 50%. Inside of these peels, these acids, are three acids blended together. So we have in both of them, we have glycolic acid, we have lactic acid, and we have salicylic acid. So the blend of these three together is fantastic for all skin conditions and skin types. Your glycolic acid is great for your pigmentation, improve the skin quality and skin function. It's an alpha-hydroxy-acid, so it penetrates nice and quickly. Your lactic acid is very rejuvenating in the skin. Lactic acid also being an alpha-hydroxy-acid. And of course, by using two alpha-hydroxy-acids, you improve the natural moisturizing factor of your skin. So immediately after your peel, the skin is hydrated on a cellular level, even though you've had a peeling action from those acids. And then we have the salicylic acid, which is a beta-hydroxy acid, being your more oil-based type of acids, great for oilier conditions, underlying congestion, breakouts. It helps with the barrier. So even though we're peeling and removing it, it stimulates that function in the skin. So you'll end up with hydrated cells, you'll end up with a more balanced skin, rejuvenation, renewal in the skin, collagen and elastin synthesis. It helps repair sun damage, as I said, pigmentation, so improving the complexion of the skin, the texture of the skin, the tone of the skin, and just in general, the overall quality of the skin. The procedure is also very simple to do, so this is a must-have in your skincare clinic. There are just a few things that you need to keep in mind when you are doing a peel. You are using an acid on someone's face. Even though a skin likes to be acidic, you're using a stronger acid. So you need to be very aware of the condition that skin is in before you go ahead with your skin peel. The happier the skin is, the better the outcome of the peel. It's like going to gym. If you go to gym when you're feeling sick, you don't feel so great after gym. In fact, you could land up being more sick. Gym wasn't the problem. The condition that you were in to go in gym was the problem. Same with the peels. The condition that the skin is in to receive the peel is what makes a big difference. The home care as well, what the client is using after the peel, will also determine how successful the peel is afterwards. The daily vitality sets are fantastic to put your clients on pre-peel to just improve the quality and the function of the skin, makes the skin a little bit more fit so it can keep up with a peel. And it comes in a nice 30 ml size or the 50 ml size, the full retail size. If you just wanted to start on something that you trust, that you know is going to get the inflammation levels down, the hydration levels up, help to sort out the barrier and the function of the skin, then it's great to start them on the Vitality set with the cleansing gel inside there. It's got the Medigel mask, it's got the Vita Boost and the Ultra Firm, and all of these are products that I love using during the peel itself as well. So post peel, they can also use those kits. So if they purchase a kit, it's nice to be able to use pre and post your treatment. You start off with a cleanse as always, and it's always advisable to do a double cleanse. So you can use the cleansing gel. I love that it's pH balanced. We disturb the pH anyway when we're doing the peels, but they are pH balanced. If you want to use the cleansing solution, you can do that as well. But I would use the cleansing solution as your pre-cleanse or to remove any stubborn makeup, and finish off with the cleansing gel afterwards. It just leaves the skin feeling nice and fresh and helps your peel to penetrate more evenly in the skin. You will then open up your bottle. Obviously there's a little dropper inside here, and you pinch the dropper and you decant the product into a little container. Okay, the smaller the better. If it's big, you're going to struggle to get it onto your brush. I do advise that you use a mask brush. At MicroSkin, we've got the little mask brushes that look like this. I love them. They are super soft. Thank you, Henry, for mine. So you can order them from her. But what I like about the brushes is you're going to get your product on quickly and evenly. You can't faff when you're putting on the peel. It starts working immediately. So you're not going to feather onto the face like a mask. You're going to dip your brush into your peel and you're going to start applying straight away. Okay, I like to apply on the forehead. I go around the side of the face, down onto the chin. You can get yourself a little bit more onto the cheek area, and whatever's left on your brush, you then apply underneath the eye. So you don't need to stop on the orbital socket. You can go right underneath the eye, not to the lashes though. Okay, so nice and close, but not touching the lashes, from the inside to the outside. Okay, so that's how you would get it onto the face pretty quick. And then on the other side, same thing, around the side, onto the chin. You can get a little bit more down onto the cheeks. Whatever's left, you then go under the eye. Do not put your brush into the peel and go straight under the eye. It's going to deposit quite a lot of product. The skin is warm and the peel is going to start running, and it will go into the eye and it will not feel very comfortable. Your eyeball's not going to explode. If you do get peel in the person's eye, you just take cotton wool with a little bowl, run the water through the eye and rinse the eye like you would do if you got tint in the eye, like we were taught in college. When you're coming down the nose, just a tip, instead of coming around the face and up the nose, I've sprayed peel into someone's eye before. That's how I know the eyeballs don't explode. It's better to come down the nose onto the face. Okay, once again, don't get a whole lot of product and then come down the nose. It's still going to run into the eyes. Okay, so you could do your application, do a little bit more on the chin, come down the nose. Okay, remember the top lip for your clients as well, and get under the chin when you're applying if you're going down the neck. Okay, and onto the décolleté. You need about 2.5 mils, so that's half a teaspoon. You need very little. Okay, so you need about 2 squirts of the little dropper inside the bottle. And you're going to apply that, as I said, nice and quick. It is going to tingle when you apply this on the skin, and the more intense the tingle, the more compromised the skin was, or the higher the levels of inflammation. So either the barrier was impaired, there's high inflammation levels, high dehydration levels in the skin, or underlying congestion, they've had sun, it could be stress. But in general, you do feel that very light tingle. If it isn't intense tingle, like I said, it's the condition of the skin, because the peel is going to penetrate pretty quickly. Those alphas, the alpha-hydroxy-acids are nice and small. So it's only going to be about a minute and then the tingle should subside. What I like to do is I like to have a look at where your client is tingling. So you can tell them, please tell them it's going to tingle before you apply it. Say, hi Mrs. Smith, this is going to tingle a little bit. I suspect you're going to tingle more on the cheek area because I can see you quite flushed today, or that is where you would have dehydrated. I know you've been in the office today with the aircon, so you're probably going to feel it more on the forehead. Or sure, Justine, I can see it's that time of the month, a little underlying congestion sitting on the jawline. You're probably going to feel your tingle more intense there. So wherever it's tingling on the skin, it's going to give you an idea of what's going on in that skin underneath. I like to give them the brush with obviously scraping off the peel, and then let them scratch. And I like to watch where they're scratching. If it's on the jawline, close to that time of the month, or there could be underlying congestion. If it's on the cheeks, it's general dehydration. The cheeks protrude further away from the face and dehydrate first. If you've been under an aircon or something like that, then it would catch you wherever the aircon has been in the vicinity. Wherever it's been blowing on you, that area would feel the tingle more. If it's all over, it could be sun exposure, if she's been in the sun, and also it could be barrier function impaired. So what you want to do is, when you're cleansing the client's skin, see how quickly or if her skin flares up during the cleanse. The cleansers from MicroSkin are very soothing, they're very hydrating, they're very comforting, and they're pH balanced, meaning they're slightly acidic. If that slight acidity bothers the skin, and she says, oh, it's stinging a little bit, or this is tingling a little bit, or this cleanser burns, you shouldn't go ahead with the peel. She then needs a MicroSkin facial or a micro laser facial to improve the barrier function, improve hydration, and get that inflammation under control. If she's flaring from the cleanser, she's not going to handle the peel very well. Doesn't mean the peel is going to be damaged or damaging her skin. She's more prone to downtime, and the risks for her peel are higher. So be aware from the cleanse already, you can tell if you should proceed with the peel or not. So the peel has been on, and it can be anything from 5 to 15 minutes on the skin. Just because it can be on for 15 minutes doesn't mean it should be on for 15 minutes. So how do you know? If the skin was tingling when the peel was applied, it normally goes a bit red as well. You get a bit of a flush from the stimulation, and it starts subsiding after about a minute and a half. Let's say about 2 minutes. And the tingling is gone and the redness is starting to calm down. Then you can keep that peel on the skin. If after a couple of minutes she starts tingling again, or the skin starts getting red again, then you need to neutralize. Okay. If the tingle has, after a minute or 2 minutes, it is still quite intense and it hasn't subsided at all, then you would neutralize. If it has subsided but it's still tingling a little bit, give it another minute or two, and then you can neutralize. So you're gauging how much the skin is moaning basically, because it's talking to you through all the sensations that it sends to the surface. If the skin is happy and it's subsided, there's no tingling, there's no redness, then you can leave it for the 15 minutes. But the minute there's a change, it starts flushing, it starts tingling, you're going to neutralize. Okay. If it's a first time client who's never had peels before, I never push it to the full 15 minutes. I would stay within an 8 to 10 minute range. And also, if it is her first peel with you, it's a good idea just to see how her skin deals with your peel. We've got a very high quality, clean, pure acid that we're using. So it is going to work pretty effectively in the skin, leaving you with those amazing benefits. All right, so to neutralize the skin, you would use your cleansing gel, and you would apply it all over the skin directly onto the peel to remove it. So you don't need to wipe it off first. Apply the cleansing gel directly onto the peel, onto the face, and work it into the skin. Okay, there's 7 points that I want you to remember to focus on. So you've applied it over the peel, all over the face, neck and décolleté if you've gone down with the peel. You want to focus on the hairline. You want to focus on the eyebrows. You want to go under the eye, corner of the nose, top lip, under the chin, and here this little weird triangle here by the ears. Most of the time when we're working on the face, we're going round and round, and we forget to go around that area there. So we're going up with our hands, this little area, make sure you've neutralized that close to the ear. Okay, so you neutralize everywhere, but make sure you've neutralized hairline, eyebrows, under the eyes close as possible, corners of the nose, top lip, under the chin, and around the eye area. Okay. Now we're neutralized, we remove it, ask her if she's still tingling, or if she is tingling, where is it tingling, and you can apply the MicroSkin toner onto cotton pads, and then you're just going to do a nice sweep over the skin with the MicroSkin toner, okay, just to help to recover the pH of the skin after it being neutralized as well. It brings nice antioxidants and comfort to the skin too. Then you can take out your Medi gel mask, and you're going to apply that onto the skin. You can do that either with your hands or with the mask brush as well, and apply it onto the skin. The skin after a peel, generally speaking, doesn't really like to be rubbed. It has had quite a workout. It's like someone trying to give you a hug saying, well done, after your workout, and you're hot and sweaty. You're not going to feel like that hug. So it's better to try and do maybe like a pressure point massage. If you've got any kind of massaging tools, like rose quartz, little stones or cold glass balls, or a little facial massager that's not too stimulating, you can do that. But otherwise, good old manual lymph drainage, you can do that on the face. It also induces parasympathetic nervous system, so you'll be relaxing your client and putting her to sleep after her peel. Okay, so that's going to be on the skin for about 10 minutes. You can do a scalp massage as well if you wanted to, and you would remove the Medigel mask. You can then apply your ultra firm moisturizer. Then your sunblock and your treatment would be complete, but I really want to encourage you to add the Vita Boost serum. I know we don't have the professional size, but after a peel, products glide onto the skin, so you use so little, but that Vita Boost serum is amazing onto the skin immediately after the peel. It is super healing. They've used that on diabetic ulcers before that won't close. The one gentleman they used it on, his diabetic ulcer wouldn't close for 5 years, and they managed to start getting it to seal with the Vita Boost straight onto the wound. So you can imagine what it would do for the skin after a peel. Super regenerating, very, very healing. It's packed full of yummies, the oleic acid, the vitamins A to K, the ava oil. It's a very soothing feeling on the skin. Once again, it also doesn't block the skin or smother the skin, and your ultra firm moisturizer is well received after that. You finish off with your sunblock. Please give your clients a sunblock speech. They have had a peel. There is higher levels of inflammation in the skin. Inflammation increases your risk of pigmentation. Do we want pigmentation? No. Do we want a good reaction? Yes. So we're going to tell her about sunblock. It doesn't last the whole day. She needs to reapply. I highly recommend the MicroSkin sunblock because it's got the heat shock proteins in, it's got the antioxidants, it's got the anti-inflammatories, it's got hydration, it's got skin support, not just the broad spectrum UVA and UVB filters. Okay. So if you're going to be reapplying a sunblock, the ones in the shops have got a lot of chemicals in them. Now you've peeled the skin is a little bit compromised, and now you're putting chemicals on, so it's not going to be too happy with you. The MicroSkin sunblock is a better option by far. So she needs to reapply. She gets about 2 hours out of her sunblock, 3 hours if you're blessed, and you can't just put it on in the morning and expect your skin to be fine the whole day. For 7 days after that peel, sunblock, sunblock, sunblock. Okay, it must just become part of her routine. I've refused to do clients' treatments before if they're laughing and joking about sunblock and that they don't use it and that they don't like it. Because I'm not going to be sitting with the blame after a peel if I do everything right and she goes and nails her skin in the sun. It's like running the comrades after you haven't exercised at all for it. It's not going to go well. So sun protection. Give her a speech. Explain to her that the sunblocks in the shops as well, 80% UVB block, only 20% UVA block. UVA being the one that damages your DNA and switches off your vitamin A and C and puts your Langerhans cell to sleep, switches off your immunity. So you've got to use a high quality sunblock to be able to use it more regularly, especially after a peel. So if you sold her your little daily vitality set and a sunblock, she would have everything that she needs to take care of her skin, prep her skin before the peel, take care of her skin after the peel. And then it's really, really smooth sailing from there. Just magical skin all the way. Enjoy, ladies. I can't wait to see your before and after pictures.